This is my video response for the bipolar disorder on ATI, my nursing interventions and rationales. So my first nursing intervention and rationale is to promote rest in a quiet environment with decreased client stimulation. Now, this will help the client to prevent any injuries and exhaustions due to increased stimuli. So, for example, try to help them get about 6 to 8 hours of sleep at night, because this will help them to not feel so exhausted and kind of sort of help them to think a little bit better. So if you happen to see them and you know it's past their bedtime and they're out wandering, just try to redirect them and say, hey, let's go read a book. And then maybe they can read the book until they fall asleep, and that might help. So, use some kind of coping mechanisms to help them get proper sleep. Number 2, so you want to offer the client frequent finger foods. Make sure that these finger foods are protein, fiber, and high-calorie foods and fluids. With these here, this will prevent any weight loss, constipations, and exhaustion due to the manic behavior. And this also meets the dietary needs for the client to eat while up and moving around, because it's difficult for them to eat because they don't want to sit down. So some examples could be like some fish sticks, which they can just grab them and eat them and hold them in their hand while they're walking. And then applesauce as well. And then your milkshake. So those are a few of the dietary items that they can eat. They can eat more, just make sure it's within their diet. And like I said, this will help them eat because they're on the move all the time and they don't want to sit down long enough to eat. So this will assist in helping eat in their meals. And number 3, remain involved with the patient while demonstrating a calm demeanor. So if you remain calm when a patient gets angry, then they will see that you are calm, and their anger may deceive some, and they'll continue to have that nurse to client trust relationship. So when the nurse is able to remain calm instead of becoming angry, it helps both the manic patient as well as the nurse to continue with a trusting relationship. So if the client gets mad for some reason and you're not even aware of why they're mad, just speak with them calm. Get some calm coping mechanism techniques and just talk to them and help them figure out what they need to do. By you staying calm, they'll stay calm. Number 4, redirect patient into more healthy activities. So by you redirecting a patient into more healthy activities, this is a distraction, and it serves as an intervention tool to redirect the patient when they are engaging in non-productive behavior. Say, for example, if a patient is sitting by the window in a facility, been sitting there for hours, haven't talked to anyone, but the behavior is well, they're not bothering anyone, but you can tell that, they're lonely and they're probably thinking of things that they don't need to be thinking of. So if you, as the nurse, just go over and say, excuse me, Mrs. So-and-so, would you like to go play cards with me? Or would you like to take a walk around the facility? That will help redirect them from non-productive behavior. Playing cards or walking, that's very productive. Playing cards will help them with their memory. And then walking around can just help them with their cardio. So try to do that with the patients who have the non-productive behavior. Like I said, just redirect them. It doesn't have to be cards. It doesn't have to be walking around in a facility. It could be any kind of game that you want. They can play bingo. You could try to get them to interact with any other patients that's in a facility, or have their family come in, whichever is best for the client. And number 5, supervise the clients of the clothes that they choose. If you supervise a client on the clothes that they choose, This helped the potential to decrease the ridicule that will, like, for example, a client who has on winter clothes and it's the summer. One, they're not dressed per season. And two, they're not dressed age appropriate. So with that being said, if you help them to pick out clothes that they should be wearing for the winter, long sleeve shirts, pants, boots, socks, and not letting them wear tube tops, mini skirts, open toe shoes, that's not appropriate. And that's also not age appropriate, because if they're 60 years old and they're dressing like that, they're dressing like they're a 20-year-old. So then people will laugh at them, ridicule them, and then their self-esteem will decrease. So if you supervise the clothes that the patient is choosing and help them choose appropriate clothes for the season and for their age, this will increase their self-esteem. And also, it will help the patient to maintain dignity. Now, if you allow them to wear what they choose to wear, they are at potential risk being ridiculed by the other people in the facility, and that will increase their self-esteem. So this is a wonderful experience. I am glad that we got to do it. And again, this is my bipolar disorder video recording response with my nursing interventions and rationales.